family. Good afternoon, Facebook family. Good afternoon, YouTube family. Good afternoon, everyone. Happy Wellness Wednesday. This is your girl, Bella, coming in, and I appreciate everyone coming in tonight. Again, thank you all for coming. What you're seeing right now, although you don't see my lovely face, is our sponsor for the night. The segment is sponsored by yours truly, Matthew Broadcast Network. Matthew Broadcast Network is a networking organization. It's very much been vetted, and I actually am a part of it. And you know what, guys? I've been doing a pretty good job on Bella Biz Unplugged. That Matthew Network Broadcast decided to extend what I do on a weekly basis, and he is going to, Stan Matthews, the owner of this lovely organization, is going to allow me to come on his platform beginning on March the 2nd at 7:30 p.m. So you have to stay tuned for that. Again, shout out to Stan Matthews. Thank you so much for sponsoring this segment. Thank you all for coming. Tonight we have a guest and we're going to go right into it. Tonight we are highlighting Fulton County, and I'm going to read two short bios on two phenomenal women. The first person is going to be Dr. Lynn Paxton. Dr. Lynn Paxton did her undergraduate degree in Romance languages at Princeton University, and she received her MD and her MPH from the University of California, San Francisco, and the University of California, Berkeley, respectively. Dr. Lynn spent over 20 years at the CDC, as we know, the Center for Disease Control and Prevention, primarily concentrating on the HIV prevention research, but she also worked several years on the malaria prevention in Tanzania and other African countries. Dr. Lynn is retired from the U.S. Public Health Service as a captain in 2018. Dr. Lynn, when the COVID-19 pandemic hit, she was asked to come on board out of retirement. Hear me, audience, out of retirement. Yep. To help the Fulton County District Health Director since May of 2020. Without further ado, I'm going to get right into it because we're pressed for time. We know we have to honor our doctor. Audience, family, and friends, I'd like to introduce to you Dr. Lynn Paxton. Hey, Dr. Lynn, thank you so much for coming. How are you doing this afternoon?
Oh, I'm doing fine, and thank you very much for having me on.
Awesome. Dr. Lynn, I'm going to get out the way because I know how time precious is, and everybody's audience is waiting to hear. We're all leaning in. Please share a little bit more about yourself, what you're doing, why you're doing what you're doing, and just please help us in the community.
Well, sure. I mean, I'm sure that no one's really particularly interested in me per se, but they would like to know what's going on with COVID, which is the reason that I came out of retirement. And it's really been quite the adventure. We've all been living under the shadow of COVID for, it seems like an eternity. I have to occasionally remind myself that the first cases were only reported in December of 2019, which is why we call it COVID-19. So we've only been dealing with it for a little under a year and a half. It just feels like it's been forever. And, the thing is that in Fulton County, as you all know, we're the largest county in the entire state. And we have really been relatively hard hit by it. We have had many thousands of cases throughout Georgia. The good thing, though, is that we are now starting to see a downturn in the number of cases happening, which is good. The reason that we're seeing that, there's a lot of speculation why we're seeing a downturn in cases, not only in Georgia, but throughout the states. And I think it's, somebody almost always asks me this, so I'm gonna answer now why we think this is happening. One is that we're coming off of the really high peaks that we actually warned everybody about and expected that occurred around the holidays when people, got together, wanted to get together and celebrate, their family and friends. And that led to an explosion of cases, just as we expected. And also, almost all respiratory viruses, which COVID is transmitted through, respiration and, breathing and close contact, they always go up in the winter when people go inside and all that. And then they tend to fall, as you move into the warmer months and the like. And I'd like to think that maybe one of the reasons we're seeing, a relative fall in the number of cases is because maybe more people are taking it seriously and wearing their mask and doing the social distancing and not gathering and the like. So while that's really great that we're seeing, falling cases, but what I'm here to remind people of is that we are still seeing lots and lots and lots of cases. And it's disproportionately affecting the people of color. The latest stats that we have is that in Fulton County, as of the 22nd, we've had over 73,000 cases, and we're still getting at least 130 to 150 every day. And it just disproportionately affects people of color in that 37% of all of those cases have occurred in African Americans and 46% of the deaths. That's compared to 25% of the cases have occurred in whites and 44% of the deaths. So we have a long way to go still in terms of, we've got still a long battle in front of us in terms of COVID. But on the plus side, we have the vaccines. And I will say that, similar to many other public health professionals, the one super bright light in all of this is that these vaccines are even more effective than we had originally hoped for. At the very beginning, I would have been ecstatic if we had a COVID vaccine that was roughly equivalent to our seasonal flu vaccine. And in a good year, a seasonal flu vaccine is about 60 to maybe 70% effective in a really great year. But the first two vaccines that we have, the Pfizer vaccine and the Moderna vaccines, both of which work under the same principle and are essentially the same vaccine, they are 95% effective. So it's sort of like, oh, finally somebody took pity on us and gave us something that is highly, highly, highly effective. So what we've been dealing with, though, is the huge issue is that we've got a highly effective vaccine out here, but number one, we don't have enough of it yet. It's still so limited quantities that we cannot give it to everyone who does want it. The second thing, particularly among the communities of color, is that we have a lot of people who have what we call vaccine hesitancy, in that there are a certain proportion that say, I'm never going to take this because why should I take something that was developed with a system I don't understand, that I don't necessarily believe in? We have the United States has a long history of not treating well, people of color, to say the least. I mean, if I have heard the word Tuskegee, I hear it 10 times a day. And, and with reason, the Tuskegee was a human rights violation. It was, I will call it falls sort of into the genocide category. And so many people are aware of that. But the problem is that many people are not aware of what actually happened after Tuskegee, in terms of Tuskegee literally changed the entire face of research, in that there are so many protections now written in to how you conduct research among human subjects that, and I was a researcher at CDC. That was my job. I led HIV prevention research trials in Thailand, in Africa, in the United States and all that. So I was deeply immersed in that field. And I can tell you, you cannot do a project in the developed world or anywhere now, unless you have passed through multiple layers of ethical review. I mean, I'm not going to say it's insane, because what it is, it's important, and it happens. And then you also have, even when you're conducting the trials, you have even another additional layer of that. You have what we call the data safety monitoring boards. They're completely independent of you. They do not talk to you. The only thing they want to hear from you as a researcher is they want you to hand over the data so they can look at it independently. And then they have the power to tell you whether or not you can continue the study, because whether or not you need to stop the study, because either it's not going to show, it's either showing harm, or it's not going to show any kind of result, or because it's very, very, very effective and it's unethical to continue to test it when you've got something that's effective. And so I've been the recipient on many times of the call from the Data Safety Monitoring Board. And they say, and all they'll say to me, they said to me was, continue. And then that's it. No matter how much you ask them, oh, what does it show? They will not tell you, because you need to have that level of disconnect between the groups. So to bring it back one thing I also remind people of is, I'm kind of old now, and so I've been doing this for a while, and I still remember the days when I started in medical school, which is back in the early 80s, and at that time, we had to fight to get representation for people of color, because everything was always predicated on what I think of as the 70-kilogram white male, because it was so much easier, and at that time, it was, they would just enroll white men into trials because they were easy to access. They didn't have all the bother of being women who get pregnant, who have menstrual cycles, who have the like. And so then we, on the front lines of taking care of patients, we're supposed to tailor all of our medications, all of our treatments to the 70-kilogram white male, when we know that not all drugs act the same in different people, and particularly not in women. So in my early days, I spent my time, arguing and fighting to get more people of color represented. And in fact, now that has really happened, and you cannot get approval for drugs unless you can show that they are useful for the populations for whom they're designed. So that's all my big preamble about sort of the results of Tuskegee and how we have moved on in the 50 years since that was, in the more than 50 years since that abomination happened. So back to COVID. So we are now, what people now are interested in finding out is, okay, is it safe to take this vaccine? And I can say yes. In the United States, we have already given tens of millions. I believe we're already over the 60 million mark for doses of Pfizer and Moderna vaccines being given. There have been no deaths. I mean, you hear in the rumor mill, things just come out of most insane things. But let me give you the truth. There have been 0 deaths that have been attributed to this. So if you hear somebody say, oh, well, Jackie Robinson was vaccinated and died the next day and it was because of the vaccine. No, that was thoroughly investigated. It had nothing to do with that. It had to do with the fact that Jackie Robinson, this icon of, for the African-American community, was 86 years old. And, there are things that happen, what we call true, and unrelated. It's true he got the vaccine. It's true he died, but they were not related. And so there are other, there are even crazier things that are, often that are talked about there. So what is the truth? The truth is highly effective vaccines that are very effective at keeping people from getting sick with severe illness and from dying. Okay, they do have side effects, as any drugs do. Aspirin has lots of side effects, but the side effects that are associated with the Moderna and the Pfizer vaccines are short-lived. And in fact, what I tell people is, oftentimes like with the second dose particularly, they might have a day of feeling like they've got the flu. And so, and it's almost like a sign of, okay, it's working. It's your immune system is actually reacting to it in a way that shows that it is learning from it, and it's gearing up to protect you against COVID. So we spent a lot of time talking to people about really why they should get the vaccine. I was the very first person at the Board of Health to get it because I pushed aside everybody. Said, I want this. You know, this is something that we all need to get. But we're still working against the vaccine hesitancy. The other issue we have is that we live in an unequitable society in which we, for years, particularly people of color, have had less access to medical care, and there have been disparities in terms of access and in terms of utilization. And we know this, and we've known it for a while. What COVID has done is just, again, put it under a spotlight, that this is a problem. It's a huge problem. And with COVID vaccinations, we're having the same issues. We have looked at the data, and we have seen that my cat is, okay. We know from the data that more white people are getting the vaccination out of proportion to their actual risk. Fewer African Americans, and actually even fewer Hispanics are getting the vaccine, even though they are at higher risk of actually contracting the disease and dying from it. So we recognize that early on and have been planning for this for a while. And so what Fulton County is doing, and I'm very happy to report that we're actually have become the model for how the rest of the state is doing this. I mean, the commissioner just today was congratulating us on this and reminding us that we're now the model that they're going to be basing some of our many initiatives on. Like at the Board of Health, in Fulton County, we've already given out 250,000 doses of vaccine, which is far beyond what has been given in the next nearest neighbor to us has given out 114,000 in that same time period. So we are almost double, or actually more than double, what's been given in our sister counties. But it's obviously not enough. What we really want to do is vaccinate absolutely everyone. And because of these disparities, we have these are the things that we're doing in Fulton County to get more people of color vaccinated, particularly people of color who do not have access to like the internet and the like. We have what we call our Health Equity Initiative, which we are working with the senior services in Fulton County to identify a cadre of seniors that are in need of vaccination and to facilitate it for them. And so the Board of Health, we have agreed to put aside a minimum of 2,500 vaccination doses per month just for this group. And that we work with senior services, they contact these seniors. They ask them if they are willing to get vaccinated. If they're not willing to get vaccinated because they have fears or whatever, they're referred to someone so they can talk to and learn more about the vaccines. For the majority do want to get vaccinated. I think they know they know how dangerous this is, how dangerous COVID is, and so for those, they are identified and they are helped. They are either an appointment is made for them, so they don't have to go into the system. If they need transportation, then that is arranged for them, either through this Uber or whatever. Then for those who need it, they're also assigned an escort, somebody to help them when they get there to go through the paperwork and the like. So it's designed to make it as easy as possible. We piloted that program now 2 weeks ago, went very well. And so now we are expanding it. And now we're going into also going to some of the senior centers There's 4 senior centers, spread out, in Atlanta, East Point, and other parts, particularly around, the southern part of the county. And so we're doing a combination. We're actually going to the senior centers and vaccinating people there. We are going to continue to send people to our larger vaccination sites, primarily at the Georgia International Congress Center. So that's one prong of the strategy. The second prong is one that we've been doing for a little bit now, is that we have what we call our strike teams, which I love it. It's a fancy term. It sounds like, we should all be in combat gear. No, it's really just a couple of nurses, some vaccine, and we send them out to some of the long-term care facilities, the smaller ones that, for whatever reason, were left out of the CVS initiative. So we took it upon ourselves to go there and vaccinate them. And so we had 14 facilities that we did that we found were left out. And so we have vaccinated them all on site. Our plan is to expand that to also go to like senior towers and some other places where there's a larger concentration of seniors, particularly in seniors that we're targeting, seniors of color, seniors of lower socioeconomic status. So we'll go on site to vaccinate them at their, where they live. The other thing is that we're working with the faith-based groups, like the large mega churches, many of whom we have worked with for doing testing. So we have a large group of people of groups that have come forward and said they want to be a vaccine site. So we are working with them right now to figure out which ones can be a good site, because what makes a good testing site doesn't necessarily make a good vaccination site, because there are different requirements. Like, for example, with a vaccination site, you need to have a place where people can wait for 15 minutes after they've been vaccinated to make sure that they have no side effects. And there's a lot more paperwork and all that. So we are currently working with that, but we were talking about that just today, and we were planning on rolling that out in sort of a big way by mid-March, but we actually all want to do that even sooner. So probably in the next week or so, we'll probably do the first one of these vaccine drives at a mega church, and then we use that to refine how our process is, and then we do more. So that's sort of the second prong. Or maybe, am I up to the third prong? I don't know, of the strategy. And then the last one, which we have not started yet, but will, because it's kind of building up on all of this, is that to use our mobile health units that we have previously used, before the pandemic. We used it for many things like HIV testing and health fairs and the like. And then when COVID hit, started using them for COVID testing. Well, we will convert those into vaccination units. And so therefore we can then go out into the community and get closer to where people are and make it easier for them to get vaccinated. And that's good, because you need to have different strategies, because not everybody's going to fall into one thing or another. Like, I was laughing because of the fact that, when you talk about African Americans and about reaching them, the first thing anybody ever talks about is the church, about using the churches to reach people. And I have to laugh because I can hear my father, his affectionate term for me was heathen, because I was not as religious as he was. I mean, that sort of strategy is not going to reach heathens such as myself. So you have to have something for everyone, because we're not all one size fits all. And so that's what we are doing at the Fulton County Board of Health to try and reach out more to people of color. We are hopeful that soon we will have more vaccine, because that is the major limiting factor. I mean, I get excoriated on a daily basis by people treating it as if I personally am holding on to vaccines and denying them. And it's not true, because what we do is, as soon as we get our allocations, we immediately start scheduling appointments, and we will not schedule out more than a week because our allocations are unstable. And in fact, last week, when there was the storms throughout the country, it halted supplies all around the country. So many places actually had to cancel appointments. We didn't get our entire allocation. We still haven't gotten our entire allocation. And so we're just, but we keep soldiering on. Good news is that, and I will stop talking in a second, but good news is that just today, the FDA gave emergency use authorization for a third vaccine, which is the Johnson & Johnson vaccine, which we're ecstatic about that, because although it has slightly less efficacy in the clinical trials than the Moderna or the Pfizer vaccines, it still has shown really, really good efficacy at preventing what you really want to prevent, which is severe disease and death. Okay, because frankly, you can live if you get symptoms of that feel like a head cold. Yeah, you're not going to be happy, but you're not going to die. What we want to prevent is people from dying, having to go into the ICU, having to be put on a ventilator, and dying. So that's the real endpoint. And the Johnson & Johnson vaccine has been shown to be very effective at doing that. And it has huge benefits in terms of the fact it's one shot only. And so you can go in, you can give the one shot, and you have this very high level of protection. So hopefully it's been approved. It'll probably be a little while before we get enough doses in to really make a difference. But we already have a plan for how we're going to use that when it comes to Fulton. We think that would be best used for our strike teams, that when they go into the housing units or the senior citizen things, and for our vaccine drives. So when at the mega churches, because then if people have to only come back once, if they only have to come in once, that is a lot easier. And also, another advantage of this vaccine is it doesn't have those really stringent storage requirements. Like, for example, the Pfizer vaccine, you have to keep it at basically minus 70 degrees centigrade. So we had to buy special freezers, and most places do not have those freezers. The Moderna vaccine is a little bit more lenient. You can keep it in a regular freezer, a regular laboratory freezer, not your home freezer, but a laboratory freezer of about minus 20. But the Johnson & Johnson is even better. It just needs a refrigerator, not even a freezer. So, there's a lot of pluses to using that. So our plan is that when we get all of these vaccines in, we'll probably deploy them slightly differently, as I said, using the one dose when we do vaccination drives, and then, keeping the 2-dose regimens for use at our standing sites. So I think that I have managed to cover most of what I intended to cover. And so really, I'll just open to any questions.
Thank you, Dr. Lynn Paxton. Right now, at this time, I don't see any questions. That was very insightful. We appreciate your time. And again, I'll be reaching back out to you to come on for another segment. I appreciate your time. There are no questions at this time. Thank you so much.
Okay, well, thank you very much and I'll go ahead and leave you on, and I'm sure the rest of your show is going to be wonderful.
Thank you so much. Bye. So, audience, we're going to move into our next special guest, LaTrina R. Foster. LaTrina R. Foster is the LPC, which is a licensed professional counselor. LaTrina is a director of the Fulton County Government Department of Behavioral Health and Developmental Disabilities. Ms. Foster has been with the department since 2008, and she previously served as the Performance and Quality Improvement Manager. She was also the interim director of clinical services within the organization. Ms. Foster is a goal-oriented and motivated leader with strong management skills. She has clinical experiences from both the public and the private sector. I'm going to let Katrina tell a little bit more about herself. So without further ado, as we move on to the segment, LaTrina Foster, welcome and thank you for coming to the Bella Biz Unplugged. How you doing?
No, thank you, Bella. Thank you for this opportunity to be able to reach the citizens throughout the state of Georgia. I hope we're connecting to everyone, as well as those emphasizing on services that we offer in Fulton County, which is very important. Dear to my heart, the world of behavioral health and developmental disabilities. Fulton County government provides services to individuals that have a mental health disorder and or a substance use disorder. We provide all of our services in an outpatient setting, so we do not have any residential facilities at all. Everything that we render is on an outpatient basis. However, don't allow that to be a hindrance. If you need to begin a process by coming to an outpatient clinic, we definitely encourage you to do that, because we do have resources to coordinate services with other entities and partners throughout the county as well. We also provide services to adults with intellectual and developmental disabilities. We provide outpatient services as well, where the individuals come to our centers, which we have 3, one in North Fulton, one in the Metro Atlanta area, and then we also have one in South Fulton. So as we all know, if we're very familiar with Fulton County, it's a 70-mile stretch. So we try to make sure that our services are spread out throughout the county so that everyone has access to care. And if you're in need of a certain category of services, we're not asking you to drive 40 miles to obtain that service, because what does that do? It creates a barrier. And so one thing that I can say Fulton County has been very dedicated and committed to is ensuring that we try our best to provide access to barrier-free services. So anything that we can think of, things that we hear from the constituents of the commissioners about being a barrier, we try our best to develop some type of strategy to ensure that we're able to establish barrier-free services. Can we do it all? Absolutely not. That's why we encourage other providers in the community to partner with us so that we can at least be familiar with your services, because if it's something that you offer and we don't, we love to coordinate. We love to partner. We love to figure out how do we ensure continuity of care for the residents of Fulton County. And so under the Department of Behavioral Health and Developmental Disabilities, it's a tongue twister, and I challenge anyone to say it 10 times really fast. But it's a big department with big hearts, big hands. We're here to serve. So guess what? It's okay. But in our outpatient clinics, let me focus on behavioral health. And so I know earlier I said mental health and substance use disorders. So when I use the word behavioral health, what I'm doing is I'm consolidating mental health and substance use disorders together. And that's why you hear the word behavioral health, because it addresses both aspects versus saying mental health and then saying substance use disorder. So when I say behavioral health, I'm talking about both mental health and substance use disorders. We have altogether 5 outpatient clinics in Fulton County. We have 3 sites dedicated to children, adolescents, and emerging adults. We have a facility called Oak Hill Child and Adolescent off of Metropolitan Avenue. We have Adamsville Regional Health Center, which is also a shared location with Dr. Paxton and her team, and that's on Martin Luther King Jr. Drive. And then we have the North Fulton Service Center, which is on Roswell Road. All 3 of those clinics provide services to children, adolescents, and emerging adults. When I use the term emerging adults, those are our transitional youth. They think they're adults, they're trying to get there, and we want to make sure we're able to help them through that transition. So that's typically your emerging adults are typically individuals aged between 18 and 24. We try to make sure that we provide them with enough resources to support their transition into adulthood. In addition to those 3 facilities, we also have 3 facilities, which one is shared with children, adolescent, emerging adult, and adults. And that's the North Fulton Service Center location. The other two facilities that provide services to adults is our Center for Health and Rehabilitation, which is located on Boulevard, which is in the Metro Atlanta area. And then our other location is our South Fulton Service Center, which is known as the South Annex. So it's the South Fulton Government Center. And we provide adult outpatient services at all three of those locations as well. Our services, please do not allow your ability to pay or not pay become your own barrier, because that's exactly what it would be, your own barrier. Because what we try to ensure is that if you do not have the ability to pay for your services, you have 7 elected officials with the Fulton County government, the Board of Commissioners, that are dedicated and committed to ensuring that we have a budget every year to make it so that we're able to offer services to individuals that do not have the ability to pay. So when I say your tax dollars are working for you, there it is. Clear as day, evident. If you do not have the ability to pay, and if you're worried about, if I go and I start services and they say I need more than just therapy, perhaps I need to see the psychiatrist and he might write me a prescription, you're good there too, because we'll make sure that you have access to the necessary medication without that access causing you hardship. So we would not ask you to sacrifice your light bill to fill a prescription. So when it comes to behavioral health services in Fulton County that are offered by the Fulton County Department of Behavioral Health and Developmental Disabilities, income should not be a question mark for you. Income should not be a driver to prevent you from not obtaining services. We are here to serve regardless of your ability to pay for those services that we render. In addition to that, we also do a lot of work with our judicial partners. We have re-entry teams at the Fulton County Jail to ensure that individuals that are booked into our Fulton County Jail, and we know that they have a mental health diagnosis, we begin the discharge planning so that we can coordinate resources for those individuals. And upon their release from jail, we're trying to make sure we link them right into those same things they said they needed. So if it's housing, if it's education, if it's an employment, if it's a high school diploma, whatever it is, our case managers work really hard to make sure that we get you connected to those identified resources. We also work with Misdemeanor Mental Health Court, which is a collaboration between state and magistrate court. And it's a diversion program for people that have committed misdemeanor crimes and they have a mental health disorder. We don't want you sitting in jail, because we recognize that if you were getting treatment for your mental health disorder, you probably would not have been interacting with the police, involved in something that landed you in our Fulton County Jail. So we divert these individuals from jail, we wrap them with supports, and make sure that we prevent them collaboratively, because we have to work together, but prevent them from returning back to the jail for the same type of crime. And so we just ensure that we provide them with the necessary resources or coordinate those resources with our external partners and partners throughout the community. And if you need additional information about our services, please visit our website. It is user-friendly. Just go to www.fultoncountygA.gov. You can just click on departments. It will show you every single department that's under the governance of Fulton County government. Click on the Department of Behavioral Health. Figure out, you can identify which location is most convenient for you. There'll be a phone number, or if you want to click, you can fill out a form, but just pick up the phone, call our number, and we're here to serve you. And we'll make sure that you're not waiting to obtain services 7 days, 14 days, because what we recognize is that when there's an individual with a mental health disorder and or a substance use disorder, at the point that they say that they need help, we need to be standing right there ready to intervene. So Bella, thank you so much for this opportunity to share with everyone that's listening and watching who the Fulton County Department of Behavioral Health is and the services that we offer. And I just want everyone to remember that we are here to serve, and we are dedicated to ensure that you have access to barrier-free services.
LaTrina, thank you so much for your time. I counted on a joy that you could have been anywhere, but you chose to be with us. And you know, Bella, I'm going to have you back, right? Thank you so much.
Wonderful.
I know you've
Thank
got
you.
another engagement, so please feel free to exit out. Thank you so much.
Thank
Right
you.
now, audience, we've got the one and only Vice Chair Natalie Hall. I'm going to let Natalie Hall close out the last 15 minutes. I'm so excited. This is like a wonderful woman. She knows she's my favorite commissioner, but right now she's serving as the vice chair. So without further ado, we're going to let Vice Chair Natalie Hall close out the last segment. How you doing, Vice Chair?
I'm good. I'm well. How are you doing? It's so good to see you. You looking beautiful as always.
I'm doing the representation of the Black History Month, okay?
Beautiful. Well, let me do a representation by showing you my mug.
Oh, that is super. But you know what I'm going to do? Support Black women. So without further ado, audience, I mean, for some of you don't know Vice Chair, she's awesome. Bella's going to get out the way and let her close out, tell a little bit about herself, these awesome team of just the two women we saw tonight, and what we got stored coming in. So Vice Chair, take it away.
Well, thank you so much, Linda. I am your Fulton County Commissioner of District 4, Vice Chair Natalie Hall. And for those of you who are not familiar with my district, it is very unique because it is entirely inside of the city of Atlanta. I have the neighborhoods from Inman Park and Old Fourth Ward, all the way northwest of the Mercedes-Benz Stadium to Fulton Industrial Boulevard. You can go up and take in north of downtown Atlantic Station, Grady High School, Howell Mill, Marietta. I have the Bolton Bankhead, Grove Park neighborhoods. If you come down to I-20, I have a portion that goes below I-20 to Campbellton Road, where the Andrew and Walter Young YMCA are located. So my district is huge. As of the census, they're saying that I probably serve now about 200,000 people. And yes, it's very large. And so one of the things that I focus on is because I was named the executive sponsor of Fulton County Strategic Priority Area called All People Are Healthy. But I don't look at that just from the standpoint of physical or mental health. I look at it from a holistic standpoint that you need to be gainfully employed. You need to have affordable housing. You need to not live in a food desert. You need access to transportation. There's so many things that contribute to an individual having a healthy lifestyle. And I look at it from that holistic approach. Now, we know that COVID-19 has been impacting all of our lives, and many of us in a negative way. But Fulton County has decided to start a rent and utilities program, assistance program. And I want to tell you a little bit about that. We're preparing to launch this emergency rental and utility assistance program based on $18 million of federal funding awarded to us through the U.S. Consolidated Appropriations Act of 2021. Over 15 million of this funding is earmarked as direct rental payments to landlords. And based on the $18 million federal funding, 1 million of that is earmarked for utility assistance. And the remaining 1.8 million will cover administrative costs such as staffing. So residents will be able to apply for up to $1,300 per month in rental assistance to cover up to 6 months of rent. You must qualify for unemployment or have experienced a reduction in your household income due to COVID-19. You must demonstrate a risk of experiencing homelessness, and you must have a household income on or below 80% AMI, and that differs throughout the county. Residents can apply up to $200 per month for up to 6 months on utility bills. With these parameters, we will be able to assist about 2,600 renters and about 1,100 residents who need utility payments. That's amazing and outstanding. And with both programs, we'll be targeting individuals who have been unemployed for 90 days or more or are below 50% AMI. Our target launch date is March 1st, so it's right around the corner. And we're going to have a call center that's being set up as we speak so that we can have a line that residents can call to receive assistance. And we anticipate that residents living inside of the city of Atlanta will also have assistance through the city of Atlanta. And we plan to address the fact that Fulton County residents do not care who is providing the services, they just want access. So we're trying to streamline that process so that if a resident who lives in the city of Atlanta contacts Fulton County government, we will streamline the process to ensure that they get over to the city of Atlanta without any glitches whatsoever. And I also want to just mention to all of you about the voter suppression bills. We not only have House bills, but we have Senate bills that are causing a suppression of our voters' rights. And let me just tell you, there are so many of them that I cannot even begin to list them all right now. But let me just tell you about some very important ones. We have HB 62, and a lot of people would not understand this unless they knew what we know. HB 62 prohibits counties, departments of registrations and elections from receiving grant funding. So let me tell you what that would have done to the Fulton County Department of Registrations and Elections. If we were not able to get grant funding, we would not have been able to get two $10.7 million of grant funding from the Center for Tech and Civic Life to assist us with our election days, and 85,000 from the Southern Poverty Law Center. That's over $20 million of grant funding. That grant funding allowed our Department of Registrations and Elections to do a lot of extra things like opening additional polling places, hiring more staff for election days. These were all things that we needed because, you know, the June election was one that was very trying. And I have to mention that the reason why it was so bad was because our Fulton County Department of Registrations and Elections were given the charge in a very short, limited amount of time to implement brand new technology, brand new touch screens for voters, voters who we know by looking at the voter rolls, most of them are seniors, a lot of non-technical users, but the Department of Registrations and Elections had to roll these machines out for the June primary election. And not only did they have to suffer the consequences of trying to do that, but they also had a number of voters that we did not expect come out early and flood those polling places. So there were a lot of things that needed to be done. We needed more polling places. We needed more drop boxes. There is a bill that they are trying to push to eliminate the drop boxes. Now, the drop boxes were instituted because it allowed us to have our voters drop their ballots off instead of going into those polling places and creating long lines. And so to have a bill that actually is going to eliminate the drop boxes is voter suppression on steroids. That's crazy. So we have a lot of different bills like that through the House and the Senate that we need to pay very close attention to. Also, I want to let you know about a food giveaway I'm doing. Every Thursday morning, I receive food boxes and take them out to the community, not only to senior high rises, assisted living, apartment complexes where seniors live, but also to seniors' homes. My team and I literally deliver these boxes and will take them to the senior's house if they don't live in a high rise or an apartment complex. And coming up this Thursday, we're going to be at the Greater Springfield Baptist Church, where we will have food there from 10 to 10:30 at 721 Jones Avenue Northwest, and also at the Northwest Library at Scotts Crossing at 2489 Perry Boulevard from 11 to 11:30. And we'll be there with food boxes for people who need the food. It is first come, first serve. So if we run out and we're still there and someone comes, we will be glad to add your name or your family's name to the list so that you can get food the next time, because I will be getting these boxes on the following Thursday as well. So March 4th, I believe it is the next Thursday when I will receive them. And you can also always contact my office by emailing me at natalie.hall@fultoncountyga.gov or calling the office number at 404-612-8226. And please leave a message, because when you leave a message, it actually creates an email that goes to my team and me. And so we actually get something that tells us that you called. But if you don't leave a message, we will not know that you called. And your call is very important to all of us. So I don't know, do I have more time for anything else? All right, well, thank you very much. So what I'll do is I'll also go over a few more of these bills, because these are so important, and we need everyone to call your state legislators, your House and Senate reps, because they are the ones voting on these bills. And the impact that this will have on you, it will take us back to the days of slavery. So let me read some of these to you. Also, we have a bill that basically says, it's HB 64. It says, this bill provides that if a candidate on the ballot for a nonpartisan election dies before the election, their name will remain on the ballot and all votes cast for the candidate will still be counted. If the deceased candidate wins the election, the contest will be handled as a failure to fill the office. Wait a minute. Didn't it just say that person passed away? So how in the world are you going to say they failed to fill the office? Of course, they passed away. But this is the travesty that we're dealing with right now. So you need to know about these. So anyone listening or watching, if you want more information about these House bills and Senate bills, please contact my office. As I stated, you can email me at natalie.hall@fultoncountyga.gov, or you can call my office at 404-612-8226. And Linda, I'm looking forward to bringing more Fulton County departments onto your show. We have so many wonderful departments, from our Office of Youth, our Department of Community Development and Housing. A lot of people don't know that Fulton County even has a homeless division that helps deal with the homeless population. We receive CDBG grants. We have a workforce development office that deals with jobs and training. We get funding to train people who've lost their jobs so that they can now go into a new career, because a lot of careers are not coming back. And so there's so much money available. People can go to school and get certifications and degrees for free. So I want people to really know about all these wonderful services and programs that Fulton County offers. And I'm looking forward to being on your show on a regular basis.
Vice Chair Natalie Hall, I don't know what to say, but we've got about 3 more minutes there. I just appreciate you. I don't think people really take the time to understand. There's a saying that we say, the non-political folks, and we say this, Vice Chair, we get people in the office and then that's what we do. We do nothing. But I can honestly say for you personally, you are in the office, you touch the people each and every day, and you take your job very seriously. From a personal heart of view, I thank you so much. And that is a little tea for all the followers. All of my followers, we will be having Vice Chair Hall come on a monthly basis to give us this very important information. Although it may be Fulton County specific, it's general, because everyone lives in a different county. Everyone lives in a city somewhere in the USA. Take heed, especially when we're talking about voter suppression, gerrymandering, and oh my gosh, so much more. I really, really cannot urge you enough, my family. That's the Bella Biz Unplugged. Listen, and as everyone follows me, stay woke. I'm going to have Vice Chair Hall leave with some comments, because you all need to understand it's not easy getting our elected officials with their 28/7 job, but when they come on Bella Biz, it's with a purpose. So Vice Chair Hall, please take us out. People are commenting, appreciating you. They're coming on the screen now saying, yes, we appreciate you. Any parting words? You got about 3 more minutes. Please, Vice Chair, say whatever you like to say at this time.
Well, Linda, you made a very important point when you said we have to be involved. Once we elect our elected officials, we have to remain involved. And so I'm asking all of our Fulton County residents that are watching and listening to please try to attend your Fulton County Board of Commissioners meetings. They are the first and third Wednesday of every month. They start at 10 a.m. We are actually doing them via Zoom right now, which makes it a little easier if you have a computer or a phone. We have a link that you can actually click on to join the meeting. If you want to be part of the public comment and give a public comment for 2 minutes, you can do that verbally yourself, or you can send your comment in writing and it will be read to the Board of Commissioners. Your input is so important. There are 7 commissioners and it takes 4 commissioners to vote on something, to affirm it and confirm it and make it so. So you want your commissioners to know what your neighborhoods, your families, your friends, what everyone needs. We used to have a $1 billion budget. This year we passed the budget. It's only a little over $800,000, but Fulton County received in addition, just millions and millions of additional funding that we didn't even expect we would actually get because of COVID-19. But we did very well on getting that money in. But I have noticed that there are services and programs that we used to have available to our communities that are no longer in the budget. And so that would contribute to why the budget amount is so much smaller, so much lower. So we need to hear from you, because you need to understand that not all commissioners understand each neighborhood. They wouldn't understand my district because they are not representing my district. So they need to hear from you to be more educated on what your needs are for your communities, so they know when a vote comes up for certain items, there are constituents out there that have spoken and told us that you need those services and programs. We're going to continue to take care of our seniors. We have Uber and Lyft for $1 each way. We have our senior transportation. We have home delivered meals. We have home cleaning service. There's so much that Fulton County has. Everything is in Fulton County. Thank you, Lisa.
No, you're welcome, Vice Chair Hall. One closing comment. We did have a variance point. I want to read this question if you can answer it. It's from Anita Lee. Hey, Soror. Anita Lee says, very interesting information, Vice Chair. What are they going to do in Fulton County that affect the state of Georgia if these House bills are passed? This is a very serious matter. It starts with the Voting Act.
Yes, yes, ma'am. So Fulton County Board of Commissioners create a legislative packet every year. And right now, our 2021 legislative packet has been taken to the state by our Department of External Affairs and Intergovernmental Affairs, as well as our consultants who are lobbyists. They go to the state with our legislative packet and they lobby for specific items that each commissioner has asked for them to put in that packet. But we can't stop there. We need our voters like you to also lobby the state. Go tell them what you don't want to see, what you do want to see. If they don't hear from you, they think that everything is okay because your vote matters. It matters to them for re-election. So let them see you and hear you to know what you want and what you don't want.
Vice Chair, thank you so much. We have run out of time. Anita, I hope that touched on your question and I hope it got answered. It did very well. Without further ado, I want to thank everyone. I thank the audience, even those who are going to be replaying this broadcast. Please, Bella Biz Unplugged, we need you. Please, we're going to have Vice Chair Hall come back again and again and again and again. Because trust me and believe me, the work has just begun. We are never finished until we finish. Vice Chair Hall, thank you so much for coming on the Bella Biz Unplugged. I thank you so much. Audience, family, I love you all. Have a great evening. And remember, it's Black History Month, not February, but 365 days out of the year. Enjoy your evening.